Hello everyone. We would like to welcome you on our today webinar. I'm very thankful that we can be sharing our summer evening time together with Dr. Gabriele Gündel. Thank you, Dr. Gündel, for making the time for us and for making the preparation for tonight's webinar. We will be talking about clinical efficiency with dental monitoring, which is a very wide subject, I can say. And you will see during the presentation that there are many aspects which we can go into the topic and how to actually think about it. For some of the rules, we would like to ask you to send us your questions during the webinar. We will answer them at the end. Please use the Q&A sections. You probably all know that. We have something new also for this evening, and that's that we have a live translation. There is a link in the chat which you can use. I will post it once again just to make sure everyone sees it, which you can use actually for the artificial intelligence translation, and you will have a transcript to your language. Once you click on the link, you only have to choose the language which you want to have the translation in, and that's it. So welcome once again, and Dr. Gündel, it's actually all yours.
Thank you very much, Martin. Thank you very much to the Dental Monitoring Company for having invited me to do a little presentation this evening. And thank you to everyone joining us before their screens this evening. I collected some nice clinical cases for you, and I would like to share with you my routine protocol with the dental monitoring concept in my practice. I use dental monitoring since 2020, and I started with only a few patients, some aligner patients, 10 patients a year, so very, very slowly. And I have to tell you, up to now, I nearly put every single patient into the dental monitoring concept because I'm really convinced that the dental monitoring is helping me in my daily routine. And this is what I would like to share with you. Maybe you are motivated or you can learn a little bit of my experiences. So the topic of the day is clinical efficiency with dental monitoring. I would like to focus on the clinical topics. I would not focus on our assistants and how our assistants can work with the dental monitoring and how they can help us. But I would like to focus on managing the office, managing our practices, make them more efficient with the dental monitoring concept. Now let's start. So, first of all, I would like to share with you some of my personal topics. So I'm an orthodontist since 30 years now, and I have an own practice in Erding. This is a very, very nice little town near the airport of Munich, and I'm there since 25 years, so quite a long time. 10 years ago, I started a cooperation with an interdisciplinary team in the center of Munich. I'm the orthodontist of this team, and I'm working together with 2 dentists and 1 oral surgeon. And here in this center, we are treating a lot of really complex adult patients with TMG, with implants, with aesthetic dentistry, with everything you can imagine, and of course, also with dental monitoring. In both of my practices, my treatment focuses are fixed appliances on the one side and aligners on the other side. So I'm really convinced that in a modern orthodontic practice, we can use still also fixed appliances and aligners, of course, as well. So I'm really very, very familiar with the Damon system. Since 2009, I treat my patients mainly with the Damon system. Additionally, since 2011, also with lingual appliances, with the Wind system. Since 2017, I changed all of my Damon cases to the Insignia system. And since 2020 now, I again changed my treatment appliances, my Damon appliances, to the Damon Ultima system. And now since 2 or 3 months, I'm really lucky that I'm one of the practices in Germany who can start with the Damon ODB system. This is not our topic for today, but just to have a feeling of the development also of the appliances I'm using in our offices. I started aligner therapy with the Invisalign aligners, but when Spark came on the market, was launched, I totally switched all of my cases to the Spark appliance because I find that there are a lot of advantages. Since 2023, I also use a concept where I can find a good condyle position in my TMG patients with the DMD system. And now I have a lot of DMD patients treating with aligners and the DMD system. Why am I telling this? Because I would like to show you that if it's possible, I like to have control about the treatment progresses of my patients, and with approval-supported systems like Insignia, like Damon ODB, like Spark appliances, I have a lot of control. And I need this control. I think orthodontists are more or less all a little bit control freaks, and control is what we have with the dental monitoring system also. And we have a very precise, a very efficient, and a weekly control about the appliances if we would like to have this. So this is how I would like to start my presentation, that I would like to transport the information that control is something we need in our treatment progresses to be efficient and to have very good results. Now, the dental monitoring delivers or gives us the possibility to control our patients weekly in a very efficient way. So my keynotes for the next 60 minutes are, I found out that with the dental monitoring concept, I can offer a very, very flexible and precise scheduling of our patients. I can plan very precise, better than before. I can tell my assistant the next time with Johnny, we need this and this and this, and I take the information from the dental monitoring. On the other hand, there is a possibility to do a very direct communication with the patient in a very, very famous way, in a way the people, the patients, the kids are used to via WhatsApp. And this is very smart. Even I, as a doctor, I'm chatting with my patients. Sometimes I do the dental monitoring myself. Sometimes my assistant doctor does it, but we do it every single morning for about 30 to 45 minutes to answer to all of our patients or to help all of the patients who need help. And this is, at the end, a very increased efficiency I feel we have in our practices. And what is following increased efficiency is an improved financial strength, because we do not have these appointments where we just say hello to the patient, how are you, looking shortly into their mouth, telling them, oh, today we have nothing to do, goodbye, come back in 4 to 6 weeks. We don't have these appointments anymore, and I feel this is very, very comfortable. So my agenda for today, just some words, some slides concerning the basics of dental monitoring, concerning my protocols, because I think a lot of you listening to me, you are maybe a little bit familiar with the dental monitoring concept. Maybe you're also using the dental monitoring, so only a few words to the basics. I have some nice, hopefully interesting clinical examples for you, how I work daily with my patients. I have some literature because I think it's important also to evaluate, to have researches concerning the value of dental monitoring. And last but not least, we have some nice conclusions and a hopefully useful take-home message for you. So my first clinical tip for you is to teach your patients to do the scans very, very precisely. There are two reasons why you should really take your time, or your assistant will take the time to teach the patients to do really good scans. The first reason is that if you do not do a good scan, you get the answer, please repeat. We cannot work with this scan, please repeat. And this is very annoying for our patients. If they had to repeat once or twice or 3 times a scans, they get tired to do it. So the first scan should be the perfect one for dental monitoring and for the work the patients have with the dental monitoring concept. This is the first reason. The second reason is you can define goals, certain goals with the dental monitoring. You can define, please give me the information if I reached my class 1 occlusion on both sides. Another goal could be, please tell me when the midline is corrected in this patient. You get the information. But if your patient is not able to do really good scans with a stable bite, you will not get the right information about class 1, 2, 3, or about midline corrections or other specialties. So this is my first tip. Teach, take your time. Don't leave your patient alone with this scanning process. Now I have in my office scans related to individual protocols. I have the Spark protocol. I have a special Damon Ultima protocol. I have a special retention protocol. And I also have an eruption protocol to monitor our patients during the eruption phase. From the deciduous teeth to the permanent teeth is really helpful to avoid useless appointments. It's time saving to do it with the dental monitoring. Now let's have a short look on my Spark protocol. So my Spark patients are scanning weekly. You can decide this if you have maybe an Invisalign patient. They have to wear their aligners, I think, 2 weeks. So you can also ask for a scan which the patient can make every 2 weeks. My scans are weekly. So the AI is controlling the fit of the aligner. The patient gets a go or no go. The AI is controlling attachments if they are fitting well. The AI is controlling the buttons, hygiene, and also recessions. Recessions is the most important topic for me to consider, because I would really like to know if there is a recession coming up, especially in aligner therapy. And I can follow the weekly scans and I can determine the time when a recession starts to develop. And then we have to react very, very quickly, not to wait until the patient is coming back after 8, 10, or 12 weeks. As I mentioned before, there's a possibility to make an input of treatment goals. For example, class 1, the overjet, the overbite, space closure, crossbites, or other things. You can define a lot of things which you can control. My basic bracket protocol is a little bit similar to the Spark protocol. So also my patient is scanning weekly. I would like to know if everything is okay with the appliance. Are the brackets intact? I have the Damon brackets, so they have a clip. And there is very, very important to control if the clips are open. This is especially for beginners with the Damon system, especially with the Damon Ultima system, sometimes clips are opening and you have to know that so that you can write a WhatsApp to the patient, please close your clip. You can do it in this way, or please come into our office ASAP as soon as possible. Is there a bracket lost? I would like to know what is about the arch wires. Are they still inserted, or are they slipped off a bracket? What is about the button, the hygiene, a very, very important topic. Also, recessions, especially with the Damon Ultima system, we have a precise talk prescription, and we have a precise talk movement of the roots. Very important to control that we don't have any recessions. Also here, you can define a lot of treatments, but, and this is a very main point of the webinar today, what is, in my opinion, the most important point is, when are the arch wires passive? Every arch wire in every system should be passive before you change your arch wire. Nobody knows, nobody knew before, when is an arch wire passive. An arch wire is passive if in a time from 1 week, for example, there is no tooth movement anymore. You cannot see this with your eyes. You cannot measure this without AI. So dental monitoring helps us to detect if the arch wire is passive. And this is the reason why I put now really every single patient with brackets into the dental monitoring. Very efficient. Now, I also have a retention protocol, but the retention patients scan monthly. And with a 3D matching, I will show you slides of this later, you can really identify if there is any tooth movement, if a retainer is broken or something like that, if there is a relapse starting. This is really, really good to develop, to detect. And I also have an eruption protocol. And I love these eruption protocols because I really can see the tooth status before I plan my fixed appliance. I also scan for the tooth eruption monthly. This is really relaxed for the patient. And also if I have opened up the space and everything is nice and everything can be passive, but just we are waiting for the eruption of a displaced tooth after space opening, this is also very, very comfortable to do it with the dental monitoring. Now let's come to the clinical examples now. First off, let's start with oral hygiene. Oral hygiene is a never-ending story for us as an orthodontist with our growing up patients. And with the dental monitoring now, it's easy for me to control and to motivate our patients to improve their oral hygiene. I have the feeling that if I show my patient here, dear patient, you have only red spots here. So the red spots show me that you cannot clean your teeth properly, very dangerous for the fixed appliance, but also I see on the red spots here that you do not do your scans in time. And this is a hint to your compliance. And I'm a little bit afraid that if you cannot do your scans on point and you are not brushing your teeth, I cannot put a fixed appliance on your teeth. So we have to wait. Please show me some green spots for at least 4 or 6 weeks, and then we can start, because we can infer poor cooperation based on the oral hygiene. I think there is this fits together somehow. And we can communicate this also with our general practitioner. We can send them the video, we can say, look at this. So we have to work together. And there's also scientific literature showing us that if you train your patients with dental monitoring about a short period of time, oral hygiene will improve. And this is a main point for the parents also. They will pay for this because they are afraid of white spots and caries after fixed appliances, right? The next topic, the next clinical example is the survey of tooth eruption. Now, how do we deal with this? I like these videos because every patient I show you, I will show you the short video. But what is the important tooth here is the tooth 45. Now we have a space here. We are waiting for this tooth. So what is the clinical relevance? Using in this point, in this situation, dental monitoring. As you can see here, tooth eruption is a scan monthly, like I mentioned it before. So the patient is doing it really every month. Now he's or she, I don't know, is wearing a placeholder just to open up the space for this tooth. And we are waiting for this tooth because we would like to make a fixed appliance. And after 6 months, so I wait 5 to 6 months. If there is happening nothing, no tooth eruption, then I write to the patient. So we need an appointment with your parents. We need to do an OPT, and for this, the parents have to be okay with that. So we always ask the parents, can we do this radiograph with your child? And we need your parents also because we have to discuss maybe surgical exposures. So we have to clear a lot of things with your parents. And this is really effective because patient is coming with parents. We can clear everything. We can do the radio. We can do everything. We are not wasting our time. If we don't monitor the patient with the dental monitoring, he's maybe coming every 4 or 6 months or 3 months, maybe every 3 months. And then we look into the mouth, we say, well, nothing has happened, so come again in another 3 months. This is a little bit a waste of time, in my opinion. So for the patient, it is a waste of time, but for us also. The next clinical example I would like to present is the passivity of arch wire and tooth eruption also. So look at this patient. Here, we are waiting. We have this appliance and we have opened up the space. And here we do nothing except of waiting for this tooth. So we monitored her with dental monitoring. And then when the tooth here starts to erupt, we bonded all of the other teeth also. And now we are waiting with dental monitoring until this tooth has fully erupted, and then we make the next appointment. And the second thing is we have the information that the upper and the lower arch wires are passive. So we can plan, we have to bond the bracket, we have to do an arch wire change in the lower arch, so we can plan very precisely what we have to do. And we know which arch wires are here inserted, and we can write down for our assistants, please prepare tooth 13 for bracket bonding, please move arch wire out, prepare for the next arch wire. This is ready. We can communicate this with our assistant without coming to the patient, without telling, okay, this is the situation now, thinking about what to do, then the assistant is starting to prepare everything. No, this is over. Assistant can prepare everything before patient is coming, and it's really effective. Short time for him, effective for us, and everything what he needs is done. So this is a look at this passive arch wire and auxiliaries also. So we have, sometimes we have power chains or we have open coils or something like that. So also if these mechanics are passive, we get this information. Latestly, I can write down, latestly, I would like to have an information after 7 weeks. And sometimes, or in many times, I get the information arch wire is not passive. So I look, everything is fine, clips are closed, bite is developing nicely. So I say, yes, okay, we wait another maybe 3, 4, or 5 weeks. So the appointment for arch wire change and bracket bonding can be prepared very, very precisely and efficient. Now, the next clinical example is the development of recessions. As I told you, this for me especially is a very, very important point. So look at this patient, look at the tooth 31. Here you see there is a recession developing. So from here, first May, to here, 20th of May. So in between 3 weeks, this recession is increasing. What is my clinical relevance? I write the patient, please, can you come as soon as possible in our office? We need to change the bracket of your tooth 31. This is not a problem. The patient is reading this, is calling the office, coming as soon as possible. We do the talk reselection. We decide on the tooth 31. We had an reclining talk bracket. Now I decide to do a proclining talk bracket to bring the root back into the bone. And again, everything is prepared. I write down for my assistant. So please, if the patient is coming, because this is my information, which is 1 week, please put the arch wire out, put the bracket off, prepare the tooth, select the right talk value, select the proclining talk bracket, Damon Ultima for this tooth, prepare everything and then call me. I do maybe another work, I'm coming, I'm putting the bracket on, everything is really predictable, and it's done in a very, very short time. Now, another interesting point of me, which I learned with the dental monitoring system, is that the passivity of arch wires may occur at different times. So here, with the patient in the upper, the passivity takes 2 months. In the lower, the passivity of the 14-27-5 arch wire took 1 month, so it was quicker. So whatever you would like to do with this information, do it. It's interesting. It's very helpful. We have a lot of input. We learn a lot of things about our mechanics and our appliances if we have these weekly scans, which can be overlaid or we can analyze them. I find this very, very helpful. So the clinical relevance is, again, individual appointments for arch wire change, only the 1 jaw, or we wait a little bit and we do 2 jaws, or we just do it step by step. How you use this information is your concept. But I think it's really helpful to have this information. Also, the loss of brackets, very helpful to know a patient is coming, he has a loss of bracket. We can again prepare everything before dental monitoring. Patient is coming, well, I lost my bracket, we have to check, do we need it, or do we have to bond it, or maybe we don't have time when the patient is there, so we have to make a new appointment. This is, in my opinion, a waste of time. How nice to know that this bracket here, look at this, is lost. It's from the 19th May to the 2nd of June, lost of this bracket. We need this bracket. We need the expansion, the rotation of the upper molar. So yes, the patient has to come as soon as possible for this rebonding. We should not wait 6 weeks. Another especially interesting part of monitoring the patients with the AI is, especially the Damon Ultima system, the developing of spaces. Sometimes if you don't have any crowding and you have this really efficiently working arch wires, the slot filling arch wires, sometimes you get some space where you don't want to get space. Please look at this video. Look here. Can you see the space between the tooth 42 and 43? This is a space you don't want this, because you have to close it. It is a waste of time to close spaces because they are developing. And if you wait too long and don't see this, maybe the space will grow, it will increase, and it takes more time to close it again. So also here, if I have the situation, look from here to here, maybe it's becoming a little bit worse. My clinical relevance is, again, hey, patient, please come in our office, make an appointment. We need to make a little auxiliary just to close your space so that your treatment progress is fine. Another thing, another very important information, how many patients are maybe calling you in the morning and saying, well, I don't know, I think there is something wrong with my appliance, but I cannot tell you what. So can I come this afternoon? And yes, of course, you will say, yes, come. We would like to have a look. Now, if we can watch this with the dental monitoring, look at this situation, please. This is a patient. We monitored the patient for the tooth eruption, and then now it is ready with we bonded the brackets. And look, please, at this situation here. Here I have the tooth 15, and it's an upper premolar, and with young patients, sometimes the gum is not allowing us to put the bracket on a right position. We are not finding the FA point to put our brackets on. So sometimes I help myself, I help the tooth to erupt a little bit by putting the arch wire gingivally to the bracket. Now this is maybe feeling, the patient feels it's a little bit strange, maybe it hurts a little bit on the gingiva, I don't know. Definitely the dental monitoring will see this and give us a tip. Well, there is something, I don't know, please look at that. And if the patient has no pain, the clinical relevance is the patient has not to come. We should not make a free chair for him. We just give him the information. We write him per WhatsApp. No emergency appointment is necessary. We will rebond this bracket. If the arch wire is passive, don't worry about that. Everything is fine. We would not see this, or we would not control this very nicely if we don't have the dental monitoring. So this is what I appreciate. And this is our daily routine. These are the questions which are coming, and we can answer them really easily. Again, here, dental monitoring is showing us what is about this eruption. Okay, so I definitely will wait until the canine is erupted fully so that I place 2 brackets at one time, not at one appointment the one and another appointment the other bracket. Also, the progress of the aligner treatment, you can consider, you can follow with the dental monitoring. So look at this patient, please. It's not only the fitting of the aligners or the fully bonded attachments, it's also the topic, have I planned my aligner therapy nicely, correctly? Is everything going fine? Because on the one side, you have the fitting of aligners on the teeth, very, very important and good information. But on the other side, I would like to know if my plans, especially in open bite cases or in class 3 cases, if I have planned my aligner cases very good. So I sometimes do it, or I often do it. I look at my dental monitoring patients. I look here, do I have a problem with the tongue? Maybe I have a spike here. Is it working nice? Now I have here the result after aligner 28. And here I have my approval, and I can compare what I planned here in my approval. And if is this really developing as the progress is good in the mouth of the patient. And if here is a discrepancy, maybe I have to initialize a mid-course correction or something like that. But then I can tell the patient, oh, I think you have to come into the office. Maybe we have to change something. and not to wait another 8 or 10 weeks. How maybe the bite will worsen or will not develop very nicely. Now I would like to follow up with my monitoring of the retention zone. So the retention protocol is monthly. Look at this. Now the patient is in a very nice situation. She has a very nice result, and I definitely would like to stabilize this result. So my clinical relevance of this is, I can ask my patient, please, could you scan monthly? If the patients get a little bit tired sometimes, I know they get a little bit tired. They are finished with their treatments, and I also would like to finish with everything concerning orthodontic treatment. But no, we have to convince them that after an orthodontic treatment, the stability is really to control long life. We have to control, we have a long life retention with our patients. So we have to back them, please do the dental monitoring further. So otherwise, maybe you will get a relapse. So, yeah. Now I have some examples from my daily life. I call it my daily life. What happened in the morning when I'm opening the dental monitoring and I have my messages? What is coming there? So on the 29th of May this year, I had a direct message from one patient. He is telling me I am missing an attachment on my lower back right tooth. This was the message. And I thought, okay, what shall I do with this message? So I had some questions in my mind. The first question, which attachment? The next question, have I to call in the patient? Is it an important attachment? Shall we plan an emergency appointment, or what shall we do? So this is really easy because I have on the one side my dental monitoring, and here from the last scan, he was just with his second aligner. So we just bonded the bracket, the attachments. So from the second aligner, there was nothing, no indication of attachment loss. So it has to be, so the attachment, he lost his attachments after the second scan, obviously. So it was only a short time. Patient wears the second aligner. So now I'm very informed here without communicating with the patient. And my question, is the attachment needed promptly? The patient does not know. He wants the answer from me. I don't know. So then I go into my approval and I check. Okay, aligner 0. Now we have aligner 2. This is the aligner of the patient. He's wearing aligner 2. And here we have aligner 5. And now I see, okay, we are just in the process of distalizing the lower molars. So definitely, and it must be an attachment here, lower, I thought it was lower right. So yes, we need all of our attachments in the lower arch to go on with distalizing the lower molars. So these informations I get without calling the patient, without having him in the office, only with my dental monitoring and my approval. And the answer, here you can see the spaces, these are the spaces. So my answer, thank you for your message. The attachment is urgently needed. Please contact the practice promptly for rebonding. And this takes 3 or 5 minutes of my time. Patient is coming, and again, I tell my assistant, please check attachments, lower molars. Please prepare everything so that we can debond. Everything is prepared when I'm coming and seeing the patient the first time on that day. Another message, another daily life example. This was a message from the dental monitor. So we have messages from our patients directly, and we have messages also from dental monitoring. So here's the message from dental monitoring, giving us the information that we have a mucosa irregularity on the region 25 and 26. And yes, look at this. Here's a ligature, a block ligature. Can you see this here? And the gingiva was not properly cleaned and is growing here over this ligature. This is maybe causing pain, maybe not, I don't know, but definitely we have to bring the block out. So yes, in this case, we write the patient, please, see there is an issue with your block on the upper left side, please come very shortly in our office. We have to fix this problem. Another example from my daily life. So a message, not from the patient, but a message from dental monitoring from the 2nd of June, 2024. So the patient has entered an unexpected aligner number for the skin. This is what the patient maybe does not recognize. And we are maybe wondering 3 or 4 weeks later, why are the aligners not fitting really good? So look at this here. So the patient word aligner number 9. After this, there was no scan, no aligner 10. Now it's aligner 11. And yeah, we have here the scan, but we don't know what happened to aligner 10. So here we have to communicate with the patient. What is going on there? Did you lose it? Or can you please have a look? We have a look in our practice. Do we have this aligner number 10? So we can communicate with the patient and we can solve this really easily. If we don't know this, the patient maybe is thinking, oh, well, I have the next aligner, and this is not remarkable after 1 or 2 weeks, but after 3 or 5 or 4 or 5 weeks, you will still have the information, well, the aligner is not fitting very nicely, but you don't know when this started. So this is also very important information. And sometimes we have this. We have patients who are forgetting the aligners or yeah, not so precise with their aligners. Now here, this is a very, very interesting patient I found out in the aspect of communication with the patient. So we get no message, but sometimes it's a pleasure for me to go over all of my patients, just to find out if everything is nice. I really like it. I like these videos. And I found out there was a patient who has a gap of changing aligners, of doing scans from December here to February. No scan, no aligner change, no appointment in the office. I thought, is she ill? What happened there? Then she came and we were asking her, we were just getting into the communication. Well, what happened to you? What is your problem? And you have to know that she has a trauma here at her upper incisors. They were reclined after the trauma. And we started the aligner therapy to upright them a little bit. And she said, well, she was really nervous. And she said, well, I'm so nervous. I don't want to finish my aligner therapy. She was at aligner 34, and I think we had aligner 42 or 45. She said, I don't want to finish and I'm afraid of getting off my aligners. And I asked, why? Yes, she said, I feel so safe with the aligners, with my teeth, I don't want to give them away. And I said, well, this is no problem. Please go on with your aligners. And if you are ready with your treatment, you get as much passive aligners as you would like to have, just that you feel safe with your teeth. And then look at this. This has to work a little bit, this information. But then, yes, she was again compliant and she worked with us and the treatment is going on really nicely. I promise you, never had these conversations with my patients if I don't have this image of no scan, no change, nothing. So this is obviously also very, very helpful to come into communication with your patients. You have many options. You can do the 3D, the monitoring with the photos, but you can also ask for the 3D matching with dental monitoring. It's a little bit more expensive. You have to pay for this a little bit more. So this is the 3D matching is not my routine protocol. I got enough information with the normal matching, not with the 3D. But it can be very helpful if you have these retention protocols. And I think if you ask especially for a retention protocol, I think you will get exclusively this 3D matching. With the 3D matching, you can follow every single tooth movement from every single tooth in every direction. I don't need this for my aligner therapies or for my bracket therapies, but it's very, very helpful to have this for my retention protocols, because the scan, you cannot scan very easily the occlusal face of your teeth. You can scan from the anterior and lateral perspective, but if you have the 3D matching and you have the calculation, you can easily find out if there is maybe one tooth starting to move. And then please call in your patient, give him an appointment, because definitely there is something wrong with your retainers. And do you know, from some literature, we have some really, really severe X effects. The effects of really huge tooth movements, relapses with roots coming out of the bone, severe progressions of this. And if we have the dental monitoring here, we just know when any tooth movement is starting and we can react on that. Also, very helpful is the possibility to have this smart STL. If you are working with the spark aligners, we have a connection between dental monitoring and the spark aligners. You can ask the patient from every country of the world, please, now you have your last aligners. I see maybe we need a little refinement. You cannot come into our office, no problem. Do your scan and give it to us, and then we can connect in the Spark Approver the Smart STL from dental monitoring with our approver, and we can work with this scan easily and properly. In the same way, we can work with our scans made in our offices. And this is really a huge advantage. So look at this. We have here a lot of scanners we can work with. So Spark is very open to a lot of scanners. And also here you have the button Smart STL. So there is a nice connection between Spark and the DMD and the dental monitoring. So these were some clinical examples. I have a lot of more, but I only have 60 minutes. So I hope that you get a feeling of how you can work with the help of dental monitoring. Now let's come to two scientific articles. The first is an article dealing with the oral hygiene. So there is an impact of a smartphone application on our hygiene during orthodontic treatment. And the result of this, I mentioned it at the beginning of my presentation, is here. The study tends to show that remote monitoring, like we do with dental monitoring, used even for a short period of time, would be very efficient to change hygiene habits and enhance oral conditions over the time. This is an article we have to give it to our parents because they are really interested in things like that. And if I say, well, we can control the hygiene during the fixed appliance of your child weekly, they say, yes, please do it. So the responsibility, they can give the responsibility back to us and we to the patient. The second study is a study dealing with a patient attitude towards dental monitoring. So how do the patients feel? Are they compliant with dental monitoring? Do they like it, or it's annoying? And the conclusions is that the patients in the study, so we had 2,248 patients. This is a really huge amount of people. So the patients in the study showed a positive attitude towards all aspects of their remote monitoring experiences. The majority find it very convenient, and as we saw before, there is a positive impact on compliance and hygiene. So this study proves that AI-powered remote monitoring can provide orthodontists with a big leap toward building a true patient-centric practice that would result in more satisfied, cooperative, and loyal patients. And this I can really tell you, this is really a fact. So we have a lot of really thankful patients. They love their scans. Now we come to the end of my presentation. I hope we are in time. I think yes. So my conclusion for today is definitely it's a fact that dental monitoring is AI supported, and the AI supported monitoring of the patient is more precise than our eyes. Dental monitoring really reveals a lot of more information than we can see in the mouth of the patient. With a weekly control, it's really possible to do individual appointment scheduling. Nearly every single patient is going out of our office without any appointment. This is also very nice for the personal situation in our office, because we don't need this, we don't have these crowded patients, this big amount of patients coming to the reception asking for a next appointment. We are saying, well, everything is fine, goodbye, do your scans, we will call you when you have to come back into our practice. Definitely, we have longer intervals between the appointments, not every 4 or 6 weeks. We have appliances which are active over 8 weeks, elastic chains, arch wires, everything is really active for at least 8 weeks. Sometimes we see our patients every 10 weeks, and we give aligners for at least also 10 to 12 weeks. If there is something to do, we see it with the dental monitoring concept. And we have a good documentation about the oral hygiene and the compliance. If I tell the patient, look at this, oral hygiene and the being on point with the scans is only red, please, we have to change something. The patient is really fixed on the red points, on the green points. They would like to have green points here. And so we can communicate this really easily. Communication with the patients. I showed you the case with the traumatic incisors. This was really very, very heartful communication with the patient. We can communicate with colleagues also, and with the smart STL scans, we can do our mid-course corrections, our refinements, our little relapses very, very easily. And for the universities, maybe could be very interesting to have a lot of data for scientific research and for learning more about our appliances. Last but not least, in practice, I think we know, and we have to calculate this. Our chair time is the most expensive factor in our practice. And dental monitoring helps us to organize the practice so that patients only come when something really needs to be done. Otherwise, they don't have to come in our offices. They are thankful for that, and it helps us also in our organization. So this means that in my opinion, dental monitoring is not only the question of efficiency, makes not only the practice more effective, but I think also more economical. And this is also a point we should not forget. Concerning dynamic scheduling with dental monitoring, we have, or you have, the opportunity to listen to Dr. Barry Benton. He is a speaker from the US, and he will tell you in September, on the 11th of September, something about the power of dynamic scheduling with dental monitoring. So I will definitely listen to him, because maybe I would like to know if I can learn something from him. So please, if you are interested, you have here the code like always. And yes, always also think about the patient journey. It's really amazing for the patients. They like especially also the adult patients, they are really looking at the videos and they are happy about the progress of their treatments. Now, to end with my take-home message, dental monitoring, I made the experience in my own practice that you should think about a practice concept where you implement dental monitoring in all of your treatments. As I told you, I started with only a few patients, and it was more or less, it was sometimes a little bit more work than help. But now, if I have this, I hope I could show you my concept, how I'm really working in detail with the dental monitoring, then you can reorganize your office, and you can you have all of these advantages I hopefully showed you this evening. So clinical efficiency with dental monitoring. Thank you very much for joining us. Thank you very much for attending this webinar. And I hope you can take something into your own practice. And I would like to give you information. Do not miss the Dental Monitoring Summit in Paris in March next year. So maybe you can find it on the Dental Monitoring website. And yeah, hopefully maybe we can meet there. So thank you very much for your attention, and maybe you have some questions.
Thank you very much, Dr. Gündel, for this excellent presentation. I liked it a lot, and we have so far only one question, and that's from one of our great DMCs in Czech. And the question is about the STL, and how do you handle the photo documentation in case of an STL when it is generated from the last scan for a new set of aligners? Well, I guess the question is mostly about the workflow, actually. How do you proceed when you request the photos or the scans for the STL, for the smart STL?
Yeah, so we have to upload the patient, then we go on the smart STL, and then the dental monitoring is asking the patient to make a scan, and this scan is uploaded then into the Spark approver. But I can make a little workflow for you, and then I can send it to you, and you can send it to the colleague, maybe.
Okay, I will. And we can also put additional information on that, because we have tested it on some of cases in Czech already, so we can provide more information on that, and also share the experience, which was quite nice already. So I guess the very important part of this is actually the communication with the patient, because as you said in the beginning of your presentation, the precision of the scanning is very important, even in the normal workflow with dental monitoring. In the smart STL, it's even of a higher priority, because the photos from the scanning have to be really well done. And we are, I would say, very strict on this in dental monitoring. We can ask the question to repeat the process if the photos are not done well enough, let's say, to ensure that we have the most precise data for the smart STL regeneration.
Mm-hmm. Yeah, of course, yeah, because otherwise you will not have precise alignments, of course. Very important.
Exactly.
I think maybe the Smart SDL, I think it's a really good function. I just had it a few times only, but I think there is also development possible to make it maybe a little bit more easier for the patient to do this perfect scans.
And we are working on that very hard to make it very understandable for the patient. So
yeah, but it's a development.
Thank you for that.
Yeah.
Yes, it is. It's quite a new feature, but already is showing quite good results. So we are happy to try with as many as possible so we can even improve the workflow for the patient and technology itself. So I don't see any more questions. So I guess we can actually thank you once again. And we hope we see you very soon in Czech for a good lecture or a meeting. I think once it's ready, we will share more information. So thank you very much, Dr. Gündel. Enjoy the rest of the summer. Thank you for coming out of your vacation to share your knowledge with us.
Yeah.
And I wish to the rest of the attendees a very nice summer evening as well, and enjoy. See you soon.
Thank you very much. And thank you very much to all of you behind the screens, and enjoy your evening. Bye-bye.